Hi, hope you tested yourself about your current knowledge on DSM-5. If not, go to the link on the screen to test yourself. This video is a briefing about the changes in DSM-5. May 2013, the American Psychiatric Association came up with the latest updated and upgraded version of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. Hope you realize the biggest change in the new DSM. It is not DSM-5 but DSM-5, a shift from Roman to Arabic numerical. Multi-axial diagnosis has been removed. Like in the other fields of medicine, now psychiatry shall also have a single axis of diagnosis. Various criteria and categories of illness have been shifted, updated, changed and shuffled. The changes could be minor to major depending on which category or criteria you are trying to look at. A serious attempt is made to bring in a neurobiological basis for the psychiatric disorders and be able to accommodate the newer neuroscientific research findings. The aim is to move ahead with times. Do you know that mood disorders and disorders usually first diagnosed in infancy, childhood or adolescence have been removed? So does it mean people don't suffer from these disorders? Absolutely not. People do still develop these disorders. The disorders which used to be classified earlier under the category of disorders usually first diagnosed in infancy, childhood or adolescence are now categorized under various other existing categories. The main reason for this change is the fact that a lot of these illnesses very much persist or remain a concern in adult life too. In the case of mood disorders, it has been split into two separate categories of bipolar and related disorders and depressive disorders. While speaking about depressive disorders category, a few other important changes are to be highlighted here. One of the most important being removal of bereavement exclusion criteria, which was there in DSM-4. This would earlier prevent us from making a diagnosis of depression in an individual during the initial 2 months after the loss of a significant person. Another important change is naming of two new disorders, premenstrual dysphoric disorder and disruptive mood dysregulation disorder. Dysthymia and chronic major depression are no more diagnosed, as they both have been brought under a new category of persistent depressive disorders. Moving ahead, in DSM-5, an attempt has been made to talk about illness as a spectrum. This tries to accommodate varied nature and severity of illness. For example, autism spectrum disorder is an omnibus category. This is a consolidation of DSM-4's autistic disorder, Rett's disorder, childhood disintegrative disorder, Asperger's disorder, and pervasive developmental disorder, not otherwise specified. In relation to schizophrenia, the very commonly discussed types of schizophrenia like paranoid, hebephrenic, and others have been trashed. Presence of bizarre delusions as an important diagnostic criteria has been diluted. Catatonia has been elevated to a new level of independent diagnosable condition. This emphasizes the fact that catatonia could be due to various other causes than schizophrenia, like severe mood disorders and organic conditions. The newer somatic symptom and related disorder includes mainly somatic symptom disorder, illness anxiety disorder, and conversion disorder. Herein, hope you noticed two important changes. Somatic symptom disorder clubbed the previous disorders like the somatoform disorder and pain disorder. And secondly, the term hypochondriasis is trashed for illness anxiety disorder. A causal event is important requirement for three disorders, namely post-traumatic stress disorder, acute stress disorder, and adjustment disorder. Trauma and stressor-related disorders category is the new home to post-traumatic stress disorder. Instead of earlier 3 symptom clusters, 4 are considered. They are re-experiencing, avoidance, persistent negative alterations in cognitions, mood arousal. Anxiety and related disorders basically includes the generalized anxiety disorder, panic disorder, phobias, and social anxiety disorder. To this old kitty, the newer ones added are separation anxiety and selective mutism. There are few other salient challenges which could be highlighted in DSM-5, like addiction and related disorders in DSM-5 for the first time includes a behavioral disorder called gambling disorder. Mental retardation is now termed intellectual disability or intellectual developmental disorder, which are less pejorative terms than mental retardation. ADHD has been retained almost same, but with 3 important changes. First, the onset of symptoms are to be before 12 years instead of the earlier 7 years. Concept of adult ADHD has been brought in, wherein instead of 6 symptoms in a domain, 5 symptoms are enough for significance. And lastly, instead of subtyping of ADHD, DSM-5 recommends to use specifiers like predominantly hyperactive, impulsive, or attention deficit. The various types of learning disorders, namely the writing, reading, mathematics, and written expression, are clubbed into one specific learning disorder. The sexual and gender identity disorders have been split into 3 categories, namely sexual dysfunctions, gender dysphoria, and paraphilic disorders. Finally, panic disorder and agoraphobia have been delinked. Hence, they can be diagnosed as 2 separate disorders having their own nature. Hope this video gave you insights about salient changes in DSM-5. Do subscribe to Augmenta Health channel to keep getting further updates on various topics on mental health. To back us up, be a fundie.